Hello M4 viewers, a grand welcome to another segment of M4 TV's Let's Connect. There is an old saying, life isn't about waiting for the storm to pass. It is all about learning how to dance in the rain. People across the globe are somehow dealing with the same situation now. COVID lockdown is teaching us how to improvise our lifestyles. In Let's Connect today, we are connecting with a very special person. He is an accomplished academic, diplomat, and a global leader in public health. He has hosted many international conferences and spoke at United Nations General Assembly in New York and World Health Assembly in Geneva. He was a consultant and an advisor for World Health Organization on several projects. Connecting with us today from Pune, Professor Dr. Joe Thomas, Associate Dean, MIT World Peace University. Welcome, Dr. Joe. Welcome to M4 TV's Let's Connect. Welcome, Dr. Joe.
Thank you.
How are you, Joe?
I'm good. How are you?
Yeah, I'm very well, thank you. Considering this current lockdown situation, it is kind of easing now, so which is it's the hope. Joe, how is this lockdown treating you? Are you one of those people learning to dance in the rain rather waiting for the storm to pass?
This is my second month in the lockdown.
Yeah, that's
I'm
right.
mostly homebound.
Yeah.
And I'm really waiting for the rain to dance.
That's right, yeah. Oh, so you're waiting for the rain so you can dance.
Right.
Okay,
because
that's
Pune
right.
is still summer. Pune it is still summer.
Ah, is it? Okay, yeah. How is this lockdown situation over there? Like, how's the people over there, dealing with it?
This is almost the second month of our lockdown.
Yeah, yeah.
And what we call it as it's almost complete lockdown for the city, and the entire nation is under lockdown.
Yeah, sure.
Very limited services are operational, healthcare services and essential services like a fire service, police.
Yeah, yeah.
And other than that, most of the services are under lockdown.
Oh, right, okay.
All the universities are shut down, schools are shut down.
Yeah.
But we immediately transferred all our teaching to online teaching.
Oh, yeah, that's
so,
good. Yeah.
So all our teaching, all our programs and our conferences, even international conferences are online now.
Ah, sure. And Dr. Joy, I figured you are a Melbourne resident who worked as an Australian advisor for East Timor. You also worked as a regional manager for Northern Territory AIDS and Hepatitis Council. Can you tell me what made you to go all the way to India and pick up a job over there? What do you do there in Pune actually?
I went to World Peace University.
Ah, sure, okay.
For the last 30 years, it was a community college.
Oh,
and
yeah,
3 years ago, this college was upgraded to a university.
Yeah.
And they are in the process of expanding their programs. And my assignment is to establish a new faculty on sustainability studies.
Ah, sure, yeah.
Under the faculty, we have 5 schools,
yeah,
including a school of public health.
Yeah.
And my faculty is supposed to contribute to the education and learning of about 300 students.
Oh, sure. Okay. Oh, that's great news. You must be a very busy man.
Yeah, because we have 5 schools.
Yeah.
And the classes, some of the classes, they begin at early morning, 8:30. And
sure.
some of the classes are late at 9 o'clock.
Okay.
So I have to keep an eye on all the classes, whether they are running properly, running smoothly, any technical backup, faculty support.
Yeah.
So, generally sometimes we joke about it.
Yeah.
We work more hours in the lockdown period than the normal period of time.
Okay, that's what I was about to ask you. How is this lockdown affecting you personally? Do you actually get any free time considering you are actually conducting webinars, conferences, back to front?
Yeah, sometimes we are in a bit of a confusion. Are we working or are we in leisure time?
Ah, sure.
But in that process, we are full-time working because there will be calls, there will be a conference call, there are telephone calls, there is inquiries.
Yeah.
And generally people feel that you are on vacation, you are on lockdown,
Yeah.
So you're supposed to be free at any given time. So calls can come
yeah.
early morning, late night.
Oh, okay. So people's expectations
Right.
are really high these days, isn't it? Because yeah, everyone's expected to be at home and free for you. Yeah.
Right, that's correct, right.
Okay. So how is this lockdown affecting the university in general? I mean, the faculty and the students, how they are dealing with it?
We have about 7,000 students in the campus,
Yeah.
but the campus as a physical entity is completely locked down. Nobody can enter the campus.
Yeah.
And all the faculty, we are at homebound.
Ah, sure.
But at the
Okay.
same time, we have a regular staff meeting, regular classes, regular conferences,
Yeah.
regular training programs, all are online.
Okay.
And one of the surprising thing is that this transition from a physical classes to online classes is just happened probably within a week. Within 3-4 days, we managed to figure out how to do the entire
That's
program
really
online.
great. Like, probably you've got a, really good technology support system.
We have a technology support system. Entire IT team is actually they're working 24/7.
Yeah, yeah. I think that's the same situation in, just around the globe. All the IT companies and the, technical support people are really feeling the crunch.
Right, that's correct.
Yeah. And how effective you think it's the distant learning for the students, the university students? I believe probably most of the students are from the metro region. Because of the lockdown, so many students have to go home, like where they live in the villages. How they are really effectively using your distant learning facility?
As I mentioned earlier, my students are coming from all over the country. Some are coming from down south, some are from the north, and some are coming from the northeast Manipur.
Yeah.
So the internet access varies from city to city, and in the villages, the internet is not that strong, particularly high-speed internet access.
Yeah, that's what I was thinking
So,
when I asked you. Yeah.
Yeah. And we didn't had time to do this assessment about the students' variable access to internet. But almost overnight, we said, tomorrow onwards, all your classes will be online. Sure. And then what we noticed that the students from the villages, their access to internet is quite often not through broadband. It's through the mobile phone internet access.
Right.
And you know that is not very strong to do a video conferencing to conduct the classes.
Yeah.
So we do a kind of a hybrid of sometime it is a teleconference, sometimes it's a video conferences, and some students are attending through the videos and some are through their mobile phones. So there's a mix of many things.
Sure.
And this also led to many of the very unexpected issues and challenges.
Yeah. Do you have any
for example,
challenges you want to share with us?
I can tell you some of the interesting stories how evolved out of it.
Yeah.
See, one of the students who is in the village and his internet access through the mobile phone range is little patchy in his home. So what he did is that he just moved out. He went to his the paddy field, and he put a chair and a table under a tree, and he was attending the classes.
Sure.
And to get a good coverage, good mobile phone coverage.
Yeah.
And guess what? One of the police officers, because the villages also they're enforcing the lockdown.
Yeah.
So the police officer saw that somebody sitting in the village in the paddy field.
Yeah.
He went and picked him up. He's in front of all of us, and saying that you're not supposed to sit here. You're supposed to go home. And then they started telling us you are not supposed to run classes because there's a shutdown. How can you do this? So we tried to explain him. All of us are sitting in our home and we're doing it. Then he said I should write a letter to the district commissioner, explaining this to release him. So immediately I wrote a letter, sent it to the WhatsApp to release him. So we had such a laugh, but rightly worried about it because the Indian police force, they can be sometimes little unkind to the people whom they pick up. So that is sort of worry.
Yep. Yeah.
But anyway, things went on smoothly. He was released.
Yeah.
So this is one of the standard joke among our students. We talk about, be careful who is the next one will be picked up. So do your classes sitting at home and attend the classes.
Okay.
Thank you.
So your student actually had to go to the police station?
Yes, right. For questioning.
Okay. Oh, that was a challenge.
It was. And all of us slightly worried about it because many reasons.
Dr. Joy, as an international public health leader, you have a very extensive travel experience, and you have traveled across more than 60 countries. And tell me which country or city you personally likes the most.
Of course, it's Melbourne.
Oh, is it? Oh, that's really good to know. Thank you.
And I'm looking forward to come back to the Faulkner Park and taking a walk.
Ah, sure. Okay, yeah. Taking your dog for a walk, yeah?
Right.
Oh, that's beautiful. Yeah. So it's getting a little bit cold this week here, but anyway, hope we are getting into the winter season. So that's expected, isn't it? Dr. Joy, as a global public health leader, what is your assessment of the current situation of COVID-19 pandemic affecting India? And how effectively do you think India is dealing with this current situation?
Like many other countries, India was also not prepared to face a pandemic like a coronavirus epidemic.
Yeah.
So I would say that the response is all of a sudden without much planning into it. But at the same time, in general, they're doing reasonably good in terms of identifying the cases, testing extensively in the national level, and also the contact tracing.
Yeah.
And those who are suspected to be at the risk of infection, and they were quarantined or they were sent for the treatment.
Sure.
So in general, they're doing, considering India's fragile public health system, and also India, we are talking about such a huge team. It's almost a cluster of different nationalities with different languages. So from that point of view, the communication is reasonably good. They're using the internet, the applications very extensively for monitoring the disease and the spread of the pandemic.
Sure. Okay. Well, that's good. Thank you for that assessment. Do you think there are any lessons the public health system should learn from this pandemic, especially India's public health system?
See, as a public health person, I have a bias towards the need for strengthening primary health care.
Okay, yeah.
Because unless there is a primary health care system is in place, you may not be able to provide treatment for the people who need treatment.
Sure, yeah.
And the second thing what is helping India is to cope with this pandemic is the extensive network of public distribution systems.
Sure.
So, and again, I would say that India's information technology capacity is helping, because Government of India has created specific apps only to monitoring the COVID pandemic, and also many of the state government, they also created their own applications to monitor the infection, monitoring the spread of the pandemic. So they use IT extensively in dealing with the pandemic.
Okay. And
Right.
how about Kerala? Because in the newspapers and in the TV channels, we hear a lot about Kerala's health system, and apparently they are doing really well.
And Kerala, they're doing reasonably well, and there is some of the mathematical modeling which I had an opportunity to take a look at it.
Yeah.
So they use extensively scientific data and evidence to monitor the program. And the Kerala has got two important aspects. One is they're providing treatment for the people who are quarantined.
Sure.
And also there is a very strong social support program.
Okay.
And the mitigation program is targeted to the economic consequences of the pandemic. People who lost job, there's an extensive loan program for the women self-help groups, those are self-employed people, and also small-scale industries. There is a compensation program. Kerala government is, from the state government itself, is offering about $2.5 billion worth of social mitigation support program by the state government. So this could be one of the reasons they managed to keep the infection under control.
Oh, that's great news. That's actually good. I have recently seen a webinar conducted by your university and conducted by your university about a course you're offering, a Masters in Public Health. Is that opportunity still on?
I offer 6 Masters program. Masters in Public Health is one of that. As part of the promotion nowadays, the students who applied, we organize webinar for them. What you saw is a webinar directly targeted towards the students who applied for the Masters in Public Health.
Yes,
Of course, the classes will begin only in August.
Yeah.
Most welcome. If anybody is interested in doing a Masters in Public Health, you know where to go.
There you go. Dear viewers, you've heard that. Here comes an opportunity for you all. If anyone's got the right qualification for that, do you know when you want to do a Masters in Public Health, whom to contact? Thank you, Joe, for that. And
Thank
I
you.
think we're just going to finish here. And thank you so much for your precious time connecting with M4 viewers today. And you're always welcome to come to our studio when you visit Melbourne next time. And thank you. You have a very good day.
Thank you. Thank you for inviting me. Good day.
First of all,